13 people in less than 1 minute. And all these names, not be Nigerian names. Only one Nigeria. Okay, 2 Nigerians I don't see. And because they are hosts. Others now.
Hello. Can you hear me?
Yes, sir. Yes, sir. We can hear you. Yes.
Yes, Wilson, we can hear you.
Okay. Thank you very much. My name is Wilson Nsabiyumva. I'm from. I think we can start because it's time.
Yes, sir. Yes, sir.
We
can hear you. Yes.
Yes, Wilson, we can hear you.
Thank you very much. My name is Wilson Nsabiyumva. Greetings from Rwanda. My name is Nsabiyumva Wilson. I'm glad to welcome you all to this webinar this evening. Let me start by saying good evening, depending on the time zone. Here in Rwanda, it is evening, but I know you follow us from all corners from the world. reason why I'm glad to welcome you to this webinar. Welcome, Madam President. Welcome our speaker of today. Welcome to all participants for this evening webinar. We are going to share insights about sterilization methods in surgical care, which will be shared by Dr. Raza Khan from Pakistan. If Israel is around, Israel, can you hear me? Maybe he's not yet joining us. Let's ask Blessings to introduce to us the speaker of today. Are you there, Ugu? Blessings, can you hear me? I can see you around. Okay. Let me introduce our speaker. Ladies and gentlemen, I'm going to introduce you the speaker of today, Dr. Raza Khan, a distinguished speaker joining us for today's webinar with an illustrious career spanning 19 years in healthcare administration and research. Dr. Khan brings a wealth of knowledge and expertise to our audience. Dr. Khan embarked on his journey in healthcare at the prestigious Aga Khan University Hospital in 2006, where he began as an operating room technologist. Throughout his career, he has contributed significantly to various healthcare institutions, including Dow University Hospital, Al Khidmat Foundation, and MIH, showcasing his dedication to advancing healthcare delivery. His academic achievements are equally impressive, having pursued a PhD fellowship and he completed an MBA and MS in healthcare management from IBT. Dr. Khan's commitment to excellence is evident in his certifications, holding the esteemed titles of 6 Sigma Black and Green Belt certified health quality professionals. He has also actively pursued further education through numerous trainings courses, ensuring he remains at the forefront of healthcare innovations. Currently serving as Senior Administrator at Child Life Foundation and concurrently as a research scholar at Aga Khan University, Dr. Khan continues to make significant contributions to healthcare practice and research. Furthermore, his leadership extends to his role as the chairman of the TORG Pakistan chapter. where he plays a pivotal role in advancing a mission of the operating room global. Please join me in welcoming Dr. Raza Khan, whose insight and expertise will undoubtedly enrich our discussion today. Welcome, Dr. Raza Khan. Over to you.
Thank you, Wilson, for such a detailed introduction. I'm very thankful for the Operating Room Global to providing me this opportunity to interact with you all. So let me share my presentation. Can you see my screen?
Yes, you can see it.
Yes, we can.
Okay. Okay. So let's start the presentation formally. Bismillahirrahmanirrahim. So today I would like to present and share my knowledge on the topic of sterilization methods for surgical instrument. In this 40-minute webinar, we will discuss the introduction of sterilization. We will discuss what is actually a sterilization, what are the methods for sterilization, and we will discuss the two methods in very detail. That is physical method and chemical method. We will also discuss briefly advancement in the sterilization and CSG department. And finally, we will discuss how and why effective sterilization is important. So let's start the sterility. We use variously the concept of sterility, sterilization. So I would like to ask very simple question that sterility is absolute state, or can say this item is sterilized or non-sterilized, or can refer this term relatively, like can say 70%, this item is 70% sterilized or partially sterilized. So people use usually. So as per my concept, I used and researchers used that sterility is an absolute state. Item either sterile or non-sterile. There is no between concept for sterility. Sterility is based on the total absence of viable life. But the absence is under specific condition, like when it depends on the type of test and the condition in which we are performing the test. Another important thing which need to be considered for the sterilization and the sterility concept, that the sterility testing is essential for surgical instruments and implant and other items that go for sterilization. We select various type of sterilization and various type of sterile testing method due to our limitations. Like we cannot sterile an item for hours and hours, or too much or excessively, because we have the limitation of cost and patient safety concerns. And the methods which used to test and assure the sterility method, like infrared spectrophotometry and chemical indicators, are used to determine the sterility in samples. So there is a chances after all this, the germs or the prions or thing can be remaining. So we need to just keep this concept in mind. And so finally, we can say the concept of relative sterility does not apply in the field of CSSD and the sterilization. An item can be either sterile or non-sterile. So we discuss all this So I think we need to, before starting the formal presentation, I would like to share the just general definition of sterilization, and would like to differentiate from the disinfection. So what is sterilization? Sterilization is a process by which all living microorganisms, both pathogenic and non-pathogenic, including spores, are killed. Alternatively, we can say, or technically we can say, a process of complete elimination or destruction of all form of microbial life, both in vegetative state and spore form. Technically, we can say in microbiology terms, we can say the reduction in sterilization is 1 exponential 6, like 100,000 colony forming units from 1 gram of a substance. On the other hand, while the disinfection is a process of complete elimination of vegetative form of microorganisms, it usually does not cover bacterial spores. And the reduction in this process is 1 exponential 3, like 10,000 microorganisms per gram colony forming units. So just I discussed this process to differentiate the disinfection from the sterilization. Both are separate things. Inshallah, we will discuss later on. So this graph, I bring up this pictorial presentation for to differentiate the both sterilization and disinfection. You can see that the sterilization, the disinfectant cover the first 2-3 level, like the common disinfectant used, the viral forms, remove the or kill the virus form, or vegetative bacteria. If use intermediate level disinfectant, it also cover non-enveloped virus. And if you use a high level disinfectant, then it may cover myobacteria. But if you use a chemical sterilant, then it may cover isoform, and the sterilization almost cover all these stats, all these things. The prions and viroids may be not killed through various sterilization. For this, we will discuss later in our presentation. So, why sterilization is important? Basically, the prevention of surgical site infection is largely depend on the methods, the way which we use, the principle we use for sterilization, and the techniques of all personnel who perform or participate in any invasive procedure on patient. The sterility of all items directly used in such procedures, the disinfection of all surfaces and other items in immediate environment is directly related to surgical site infection. To discuss the sterilization concept broadly and discuss the nomenclature and the hierarchy of sterilization, this pictorial graph is showing that the commonly 3 types of sterilization methods, that is mechanical method used for usually disinfectant, the physical method, we will discuss in detail this method, like heat method, that dry heat, moist heat, autoclave method, and the radiation method. And we will also discuss the chemical method, in which we will discuss the sterilization with the help of machine, liquid chemical sterilization with the help of machines, and chemical sterilization without machines. So the physical methods for sterilization instrument usually are 4 or 5 types. Commonly, we will discuss the most common methods here. So the heat sterilization, in the heat sterilization, we will discuss dry heat and moist heat, and we will discuss the radiation sterilization, gamma radiation, electronic beam, or X-ray beam radiation. We will discuss the air filtration method and ultrasonic cleaning method. And in the chemical method, we will discuss the process with the help of machine, like ethylene oxide, plasma, sterilization, and LTSF. And we will also discuss on the most common chemical which used for the sterilization, like alcohol sterilization, formaldehyde sterilization, and glutaraldehyde sterilization. So let's start. First of all, the heat sterilization. In the heat sterilization, there are dry heat sterilization. There are two common methods which use worldwide commonly. Then one is the dry heat or oven, and the second one is infrared, can be your oven method. In the dry heat method, we use, this method involves the use of high temperature for a prolonged period. If we discuss the process of this method, in this method, instruments are placed in an oven and heated at a high temperature ranging from 160 degrees centigrade to 180 degrees centigrade for a duration to 1 to 2 hours. This is a cost-effective and effective against a wide range of microorganisms. It is non-corrosive to instrument and suitable for items that can bear high temperature. Commonly, we use this method for sterilization of ophthalmic instrument and glasswares. This method has certain limitations, like it required long sterilization cycle and may cause the items which are sensitive to heat material, which cannot stand with such high temperature. The infrared conveyor oven method is nowadays lethal and rarely used. In this method, items are passed on a conveyor through a tunnel heated by with the help of infrared elements. The infrared radiation is nowadays not commonly used. The second, the moist heat method, which is also commonly known as autoclaving method. In this method utilizes steams under pressure to achieve the sterilization. In this process, instruments are in the process of autoclave involve instrument placement in an autoclave and exposed to a saturated steam at temperature above 100 degrees centigrade, like 121 degrees centigrade for the low cycle and 134 degrees centigrade for high cycle for 20 minutes. Nowadays, literature says that for a low cycle, we can keep item only for 15 minutes, and for a high cycle, we can at 134 degrees centigrade, and we can keep instrument for 3 minutes. The literature are also available on this. This method is very common worldwide, very cheap and very effective method for various type of items. Like we can use this method for the linen, for the rubber, for the instruments. In this method, the steam is penetrate very easily through packed materials, and it is we can use this for this package containers, instrument containers through filters, and for porous papers, micropore papers, and in this method, heat pass through all these stuff. This method has also some limitation, like it is not suitable for heat-sensitive materials like rubber things and delicate instruments, because this method also involves certain pressure. And this method is also non-effective for items which are sensitive to moisture, like papers. So discuss a little bit detail the autoclave process. Autoclave. What is autoclave? Autoclave is a closed chamber in which objects are steamed and heated to high pressure with a high pressure and high temperature usually above 100 degrees centigrade, like 121 and 134 degrees centigrade. Autoclave is also, there are usually we use three cycles or three types of autoclave. That is gravity method, that is vacuum method, and the third one is liquid mode. So usually in the modern autoclave, these all three cycles are included in a single autoclave. As we discussed, this is a very efficient and good method of sterilizing item and effective. Like because in the vacuum method, the all air removed from the starting of cycle to penetrate the heat well in the chamber, because usually the air pockets prevent the penetration or the equalizing of heat. So the vacuum method is very effective. Usually the process of autoclave is not just to put the instrument in autoclave and get it sterile. It requires 4-5 phases. The one the phase which need usually the CCG experts exert their so much efforts on this stage, that is the loading phase. We will discuss this phase later. The item packaging, cleaning, disinfecting method. Also, the second method is the heating phase, in which the certain temperature or certain heat is achieved. And the third one is the actual process phase, or the destroying phase, in which we heated the instrument to for the high cycle and the low cycle. And the fourth phase is the drying and cooling phase. And another important phase, that is the testing phase. We will discuss the loading phase and testing phase in little bit detail. For the loading phase, required various steps like decontamination of instrument, disassembly of instrument, and sorting out all instrument properly, the checking of instrument, and then the washing and disinfecting of instrument, the drying of instrument, and packing, and then loading in sterilizer. So these all steps are required in loading phase. The testing phase, why the testing is very essential, because without testing, we can not sure that the sterilization done or not done. We use various type of testing for autoclave. One very common test you guys used in across the world, that is buoyant test. In this test, we put a chip or put a paper type indicator, chemical indicator, to check that the air is removed properly from the sterilizer chamber or not. If there is no air pocket, it ensures that there is no leakage in the chamber, there is no air pocket in the chamber. Usually this method is suitable for free vacuum type steam. This is not suitable for gravity displacement sterilizer, which used for glassware sterilization or glassware stuff sterilization, or for unwrapped instrument. And this method is also the gravity method is also used for decontamination or biohazardous waste. So the buoyant test is primarily in this. You can see this buoyant test in which you can see the yellow is unprocessed. Yellow color shows the unprocessed cycle. The black shows complete black color shows that cycle passed satisfactorily, and the partial yellow and black indicator shows that there is some air pocket or some leakage in the test. So the cycle is not satisfactorily completed. There is also another important step in which we check our autoclave. That is manual step. We check the gauges and the meters given on the sterilizer. We use physically the chamber for the scaling. We check the pH of water, which used for the autoclaving and verifying other meters. Usually, this process carried out by biomedical engineers in healthcare setup. The third step, or the third thing through which we can assure the efficacy of autoclave, that is use of chemical indicators. Various types of chemical indicators are used commonly worldwide. Like we use autoclave tapes, we use indicator strips and cards. You can see such different type of indicators mentioned, like three parameters indicator, 5-parameter indicators, autoclave tapes, usually. These chemical indicators are usually used in every cycle. Usually, people in developed countries and middle income countries put the indicators in every stack. If there is limitation, then the people can skip, but it is recommended to put indicator in every test and every pack to show that steam, temperature, pressure is sufficiently provided to that load or that cycle or that stuff. There's the fourth method, which is very essential, that is biological test or biological indicator method. That is that help us to check the efficacy of autoclave. For this, we use some spores like Jew bacillus, formerly bacillus, and put in autoclave, and then we grow. In the past few days, few years ago, we used to grow the culture in lab or incubator, but nowadays we are using the vials, which help with the help of color change, indicate that spores are grown or not spores. So in the picture, you can see the yellow and the purple tubes that is used for biological indicators. There are like this is very autoclaving is a very effective method, but there are certain things which need to be considered, which need to be keep in mind when we are sterilizing our instrument through this method. There are common errors or common chances of error due to poor quality steam. If there is failure to remove air or condensation of air condensation, air condensation. If the gauges are faulty or the timings are improper, then might be our load cannot be proper. If there is leakage in door seals, so it can also cause ineffective sterilization. And if we load too much stuff or we not load the proper cycle in proper way in autoclave, then our autoclaving or sterilization may be compromised. The second method of physical method is radiation sterilizing. The common thing, very commonly used, usually in pharmaceutical industry and like commercial method for instrument sterilization is gamma radiation. It is effective for the plastic methods, also for the metallic methods also. In this method, we use high energy gamma rays to kill microorganisms. In this method, instruments are exposed to gamma radiation from a radioactive source such as cobalt 60 or cesium 137. This is very effective uh, way to sterile the packed stuff. It has in this process no residues remains, and it is suitable, very suitable for heat sensitive material. This method has also some limitation, like it required very specialized facilities. There are so much regulatory restriction need to follow for this method, and in this method, the material and things it exposed too much long, then they have degradation issue. The second commonly commercial method used to sterilize or in large hospital use, that is electronic beam or E-beam radiation. This is also the gamma radiation and E-beam are also ionizing radiation method called also. So in this method, we use high energy electron beams for sterilization. Usually the process involves instrument to expose a high electron beam, accelerated electron, in a vacuum condition. It is a very rapid, rapid and effective method. Um, in this method, we can kill a wide range of microorganisms. It is very effective for delicate items. But similarly, like gamma radiation, it has some limitation. It has low penetration power than as compared to gamma and X-ray radiation. It requires specialized equipment, costly equipment, and also not suitable for multiple times. The examples or the method which is non-ionizing radiation method, that is the use of ultraviolet light. UV light, we use commonly we use UV light for the environmental disinfection, for the theater disinfection, and in the commercial or non-commercial use, people are usually sterilize the bone chips, grafts, and blades through UV light method. But this is very not very good method because it only disinfects the surface. It has very low penetration capacity, very poor penetration capacity. So if the items has residues or like multiple layers, then this method would be not effective. There are also a few common methods in physical method, that is air filtration and ultrasonic wave. In air filtration method, like sterilize or equipment passing through cabinets. Now we use in modular and modern ORs this type of method. In this type of methods, instruments are placed in a laminar airflow cabinet or clean room. It usually clean the surface air or prevent the environmental or airborne infection. It is suitable for it is, I think, as per my understanding, and as I know that this is not a proper sterilizing method. Yes, this method can extend the sterility of items that are opened in environment, or like as compared to contaminated environment and other environment, these HEPA cabinets can assure us the sterility of equipment instrument for a longer time of period. The ultrasonic wave method is also usually used for disinfectant and cleaning of delicate instrument. In this method, high frequency sound waves are used to remove the contaminants from the surface of instrument. In this process, instruments are submerged or dipped in cleaning solution, and ultrasonic waves create cavitation bubbles that dislodge germs and contaminants. That is effective um, way for cleaning of delicate instrument, micro instrument, but it also removes biofilm and organic matter. But it has also limitation that this is not a proper approved sterilizing method, because this method required a further process of sterilization, like when we use this ultrasonic cleaning method, disinfectant method, we use usually sterilize the equipment further through autoclaving or through plasma. Just give me a minute. Sorry. So, can you hear me?
Yes.
Am I audible?
Yes.
Okay, sorry. So, ultrasonic cleaning is a cleaning method, not a proper sterilization method. So when we talk about the chemical method of sterilization, instrument sterilization, it involves usually two types. That is chemical sterilization with the help of machines and chemical sterilization without the help of a machine. The methods which utilize or require the machine helps, that is the common method is ethylene oxide. This is very well established and common and old technique for sterilizing the items which are sensitive to heat. In this method, ethylene oxide is used to disinfect and sterilize instruments. It is very effective in a wide range of microorganisms. In this type, instruments are placed in a sealed chamber and exposed to ethylene oxide gas under controlled condition. As we discussed, this method is very effective for heat-sensitive material and delicate items that cannot bear heat or pressure, but it has some limitation that it has very strict compliance and regulatory requirement. And need to very strictly monitor ethylene oxide level. There are certain disadvantages of this method. Usually, this method required very lengthy process and long exposure and aeration period also after the sterilization. Usually, used sterilizer are very expensive, more complex process. Liquid ethylene oxide sterilizer. Liquid ethylene oxide sterilizer may cause serious burns when exposed to skin. Insufficiently aerated materials can skin irritation, skin burns, and hemolysis of blood. it also may cause plastic stuff. The most importantly, ethylene oxide is a toxic and can cause cancer. So it is very essential to take precaution and use the proper PPE for this method. And also, the use of indicator is very essential in this method. The second very commonly used method is LTSF, low temperature sterilization with the help of formaldehyde, called LTSF. In LTSF technology, we use the formaldehyde at lower temperature for sterilization. Instruments are usually exposed to formaldehyde vapor in a sealed chamber. This is effective and a broad spectrum pathogen destroying mechanism suitable for heat sensitive materials. It has also some limitation that if there is poor ventilation, then formaldehyde can create the toxicity. In this method, validation of sterilization for the efficacy is very essential. The third and the latest method is plasma sterilization, also called low temperature hydrogen gas sterilizer. In this method, we use hydrogen peroxide vapor and low temperature plasma gas to sterilize the instrument. Usually it involves a series of steps to achieve the sterilization. The most common, very good advantages of this plasma sterilization that it is very rapid, very quick. There is no toxic residues in this method. It is very suitable for heat sensitive materials and delicate instrument. It has also certain limitation, like we cannot process linen and papers through this method. Similar to other like autoclave, there are certain indicators which can be used to assure the sterilization through plasma sterilizer. And the second part of chemical sterilization without machine, in this very commonly we use alcohol sterilization. Alcohol-based solutions are used for the disinfection of surfaces and small instruments. Usually in this method, the instruments are immersed in alcohol solution, in high concentration alcohol solution, and can use alcohol wipes to clean, disinfect surfaces. This method has few limitations, like fungus growth is very common in alcohol containers. If you use one container for multiple times, so it needs to very rapidly change the containers. It is alcohol evaporates very quickly and can cause fire. So that is why usually it is old technique, and usually the people use alternative methods. The formaldehyde, second way to sterilize the instrument with the chemicals, that is formaldehyde sterilization. Formaldehyde is a very good sterilizing agent. In this method, instruments are exposed to formaldehyde gas or liquid solution for specified duration. This method is very old. People use this method for more than 50 years. But this method has few limitations, like it required a proper use of appropriate PPE, personal protective equipment, like it can cause the toxicity. Its pungent smell is not very good. So, and it is also effective, non-effective for the linen and paper stuff. The third method is glutaraldehyde sterilization. It is usually very commonly used for laparoscopic and plastic equipment. Glutaraldehyde liquid is very good sterilant, used for heat-sensitive instrument, more rapid, effective, and less irritating as compared to formaldehyde solutions. Usually, in this process, instruments are immersed in glutaraldehyde solution for a certain time. But it is also carcinogenic. You need to when you are selecting this method, you need to ensure the proper dilution, proper exposure time, proper adequate ventilation to get proper thing. As we discussed, the glutaraldehyde is also carcinogenic. So there are few alternatives methods are available, and nowadays new chemicals are introduced that is called aldehyde-free alternatives. Different brands are available. It required very less time, less toxic, and non-carcinogenic as compared to glutaraldehyde. It has fast efficacy and very efficient. So this, and of course, that is free of aldehyde. So when we have discussed multiple methods, so how can we assure that which method is most suitable for us or most good for us? How can we select the best one method? So there is, if you ask this question, then there is no one single line answer. It is essential for sterilizing agent to be in contact with every surface. If you select a method in which the instrument or the sterilizing agent is not in the contact with the instrument, then this method might not be effective for you. And surgical instrument, linen, heat-sensitive items are sterilized by method recommended by the manufacturer. So follow primarily the manufacturer's guideline for the instrument, and secondarily, then you can apply the knowledge. There are various advancement in sterilization in CSD fields. With the help of robots and automation, we can get the thing faster and in a better way. Although it is replacing the humans, but this method is no doubt very effective. The use of robots and automation is very effective, very time-saving. Surgical instruments, nowadays the robots and automation process involved in every process of CSSD, from the arrival of instrument in CSD from OR to CSD from OR till the packaging and the storing. The robots are helping throughout. There are various advantages, like it has improved consistency, it has very huge reduction in human errors, and the efficacy and the efficiency is very good. If we talk about the examples, nowadays in the developed countries, automated loading and unloading sterilization chambers are frequently used and common. The robotic disinfection systems are very common. The robotic storage and storage machines are very common. Another good advancement in the field of sterilization to choose the good method and the effective method for the sterilization is AI and machine learning. With the help of AI algorithms, we can optimize the sterilization cycle. We can use the customized cycle parameters for each and every instrument. Like with the help of this AI and machine, if we select the instrument type, it will help us and suggest the appropriate method for the sterilizing of equipment. It also help, we can use the help of AI and machine learning for predictive and preventive maintenance, and it gives us real-time monitoring of all the processes of autoclave plasma pitching. Usually nowadays, this AI and machine learning are built and incorporated in every modern machines. So all this is from my side. If there is any question, you may ask. Sorry, it took a few minutes more, but anyone can ask question.
Thank you,
Yes,
sir, for that wonderful presentation. Okay, this is time for question and answer. If you have any question, please use the chat box or you can raise up your hand. So I'll start with the raise up hand. Yeah. So Abdul Rahman, please can you ask your question?
Hello everyone. Hopefully everyone will receive this message with the best of your health. Thank you so much, Sir Raza, and organizers for such a great activity. My concern and my question is related to about how can we show the quality of our sterilization in chemical sterilization method. I mean to say, when we use chemical disinfection, we add some solution disinfectants and water solution. How can we assure the quality of our sterilization or of our sterility? Is there any parameters like as we can see in our moist heat sterilization, there are some chemical, biological, and some physical and mechanical indicators. How can we show our quality in the chemical disinfection method? And my secondary concern about the how what are the protocols about the specific diseases like hepatitis C virus, hepatitis B virus, the instrument that are contaminated with these blood that are suspected with HBV, HCV. So, which method would be the best for their sterilization? Thank you.
Okay, thank you, Abdurrahman, for asking the question. As concerned to your first question, for like if we use the chemical sterilants for the sterilization, so this is the limitation of chemical sterilization, that there is no proper method to monitor the efficacy of chemical sterilization. It all depends on the dilution, the preparation of solution, and the contact time of instrument recommended by the manufacturer. But we can use like culture frequently. Usually in our setup, we used to send the culture of chemical to see that this prepared solution is effective or not through our lab. Nowadays, there are few solution like glutaraldehyde. There is indicators that are available to check efficacy, but it is not very commonly available. So you can follow only the manufacturer guidelines only. As for your second question, for the disinfection or sterilization of the instrument contaminated with hepatitis B, C, HIV. So chemical sterilant, high-level disinfectant are very good, and followed by the autoclaving method. It's very good if the instrument can bear the heat. If the instrument cannot bear the heat, then we can follow the plasma sterilization and the DSF, extra. So when we combine the chemical and the physical method, it will give a good effect. Usually, the hepatitis B and C can be covered with the chemical sterilization. I hope I clarified.
Yeah, thank you so much, Raza. Thank you.
Mr. Zubair Qurban, you have raised your hand.
Yes, Assalamu alaikum. Thank you for this information about sterilization method. Very good informative lecture today. My question
Zubair,
for
your
you.
voice is not clear. Your voice is not clear. Can you repeat your question?
Who food for Kawe? Fejiro.
Okay, my question, how can measure shelf life of sterilization packs as like instruments? What is protocol about shelf life?
So for the shelf life, the first gold standard is if the package, like if you use the microcoat paper or the pack is not open or has no pores. It's the one. If the pack is damaged, then the sterilization is not guaranteed in autoclave method. The second thing, it all depends on the storage. If you store the items in the heat or in the humidity state, then the sterilization might be ineffective very quickly. But if you store the package, the sets properly as per the recommendation, then it maybe can use for 60 or 90 days. Depends upon the type of material you are using for the packing and the wrapping.
Okay. Thank you for the answer. We have some questions in the chat box. The first question is, the first question from always. The question is, for a PLWH, is it the same process of preparing used materials and instruments post-operation before sterilization? That's the question.
Sorry, can you repeat the question? Sorry, I cannot hear due to noise.
Okay, the question is from Alexis. The question he's asking, for a PLWH, is it the same process of preparing used materials and instruments post-operation before sterilization?
Okay, so Alex, what do you mean by PLWH?
It's people living with HIV.
Yes.
People living with HIV.
Okay, so for this, the same method can be used like other we use for the sterilization. Same.
Question about sterilization of instruments using for PLWH, and you are not telling us the full meaning of PLWH. No light.
Yes, no, a little bit noise.
He has it in the chat box. It says people living with HIV. Yeah, people living with HIV. PLW.
No.
Okay, now for the HIV and this, so the same method which we are following, it is effective, equally effective. there is no special treatment for HIV. It is always good to follow the sterilization process after disinfection. That it gives an added advantage. I hope, Alex, I clarify.
Yes, I understand. Thank you.
Okay. Okay, the second question from the chat box is from Emmanuel. Okay. The question says, how should glutaraldehyde be constructed, and what is its exposure time?
Okay. Emmanuel, glutaraldehyde preparation, for the glutaraldehyde preparation, there are various type of variants of glutaraldehyde are available in countries. In Pakistan, there are also different. But for this, you need to identify which type of solution you are using. If the dilution is high, we can label this type of solution with low level disinfectant, LLD. For this instrument need to require to usually for prolonged hours as per the recommendation of agent or manufacturer, like 6 to 8 hours. If there is intermediate level disinfectant, then usually it took 1 to 2 hours. And if there's high level disinfectant, like if you prepare the glutaraldehyde solution and non-glutaraldehyde solutions in concentrated way, then the exposure time and the exposure time required less, like 15 to 30 minutes. So it's depend on manufacturer guidelines.
Okay, thank you, Musa. Okay, the next question from Alex. The question is he's asking about the quantity of alcohol that can be used to surgical kits for a circumcision.
Okay, so Alex, nowadays FDA is also FDA and other healthcare commissions are also approving the chemical sterilization without machines for various type of surgery, like for laparoscopic surgery, the glutaraldehyde and non-glutaraldehyde alternatives are commonly used for disinfection and the sterilization of laparoscopic instrument. So can use for minor surgery as well. But if you are using the metallic instrument in chemical sterilant, then it may cause rust, or it can. This is a limitation. But for minor surgery, you can use. I hope I clarify your question.
Okay, the next question. The next question here is asking about some examples of glutaraldehyde used in hospital. Examples of glutaraldehyde.
Okay, like example are glutaraldehyde solution like Sidex solutions, like Tricidin. There are multiple brands available glutaraldehyde. The common was the Sidex and aldehyde X available in Pakistan. So in Africa, I think Sidex and the Tricidin are also available in Africa also.
Okay. Okay, the next question says, how effective is alcohol sterilization?
Alcohol sterilization was very classical and old method. Guidelines say that the 90% and 70% alcohol can be used for the sterilization of equipment instrument, but it gives a very low level coverage. Like it can cover the vegetative state, but the spores maybe not the spores which are resistant to the alcohol may not be killed through alcohol sterilization. But for minor procedure, you can use for the dressing, like you can use alcohol sterilization. But usually nowadays, it is not very recommended.
Okay, sir. Next question says, what about double packing lubrine, linen packing material? What will be the expiring dates?
So,
the question is from Rema. The question is, he's asking about what about double packing within linen packing material? What will be the expiring dates?
okay. So, sorry, the question from Muzammil or so can you repeat the question? That is the question from.
Okay, the question is, what about double packing weaving? Then linen packing materials, what will be their expiring dates? Once they are being packed, how long will they take before, if they are not used?
Okay, so like double packing of linen and woven is required and essential, recommended nowadays, and this is recommended to use microfiber paper. I'm answering the question of Abdurrahman Saleh, and if I talk about the next question, that is shelf life storage of sterile pack without opening. So I fairly answer this question. If this environment is as per the recommendation, temperature and humidity is controlled, then you can store item from 60 to 90 days. If the packaging material is good, so you can maybe use for up to 6 months, but usually 60 to 90 days. And sorry, now what was, I think.
Okay. Okay, the next question, another person is asking, what do you mean by cobalt 60 or cesium 137?
No, cobalt 60 and cesium 137 is basically radioactive materials which used for this in this process. So these are both separate radioactive materials.
Okay.
Used in gamma sterilization.
Okay.
I hope clarify the question of Muzammil. Yes.
Yes. Then question from Precious. The question is asking, is enzymatic and glutaride solution effective as a high-level disinfectant?
It's yes, enzymatic cleaners and glutaraldehyde solutions are effective as high-level disinfectant, but it depends upon the concentration of and the preparation of material solution. If you prepared in the high-level concentration, that it is as much effective as high-level disinfectant. Glutaraldehyde is a high-level disinfectant.
Okay, sir. Then the next question from Farija is asking about The laparoscopic scope and the pteroscope, then hysteroscope, are autoclavable. At what degree of temperature of cancer such scopes should be autoclaved?
Yes, laparoscope and hysteroscope can be processed with the low level cycles. Well, nowadays, laparoscope and hysteroscope can bear the heats if you are following the recommended and the good valuable brand. So it can be sterilized to the low cycles as well, and you can use the chemical sterilant for stereoscope and laparoscopes. Glutaraldehyde is effective for both.
Okay. Okay, the next question from Ahmad is asking, what is your recommendation about standard for checking of autoclave efficiency tests like biological tests? That is every week or after 3 to 4 days.
Okay, so usually the autoclave efficacy test, it is like we discussed the 4 types. It depends on every, like the use of chemical indicator is essential for every cycle. The mechanical test is essential for weekly or daily as a part of daily activity. The PUVI tests usually run every day before running the load. And the method, which is the biological test, it is usually recommended in a week if there's no too much medium load of CSSD, then it is recommended to at least run within 7 days or within a week 1 test. Because the spores grow and incubation also require 3 to 4 days. But nowadays, as I discussed, there are alternative vials and test strips are available, which give you a very quick response after a cycle. The color change from one color to second color indicates that the spores are effectively killed in this process. I hope you get that.
Okay. Thank you, sir. Then the question from Precious, she's asking about, can glutaraldehyde solution be used in patients with hepatitis and HIV using laparoscopic instruments?
Yes, glutaraldehyde solution can be used. Like I discussed previously, that the combination of 2 methods is very good for infectious disease. If you are using only chemical sterilant, then it is recommended to do 2-step chemical sterilization. Like 1 step, you can do the disinfection of the instrument through low level or intermediate level disinfectant, and in the 2nd step, you can dip these instruments in a chemical sterilant that the items which are resistant to the low level may be killed in this. But if you use single glutaraldehyde, it is also effective. But the recommended is to use in 2 steps: 1 is disinfection, and the 2nd sterilization step.
Okay, thank you so much, sir, for this wonderful presentation. It is very educative. Now I'll be handing over to our president. Thank you so much, sir.
Thank you so much, Dr. Raza Khan. Thank you, all the organizers, the Education and Training Committee of TORG. I must say thank you to everyone that connected, despite the fact that the timing is not on our side and everyone is busy in their respective workplaces. I must say that this is the best presentation on sterilization methods that I've ever listened to. Honestly, it's the best that I've ever listened to. Very comprehensive, so much organized and detailed, and lots of positive feedback as well. Thank you, Dr. Raza Khan, for taking the time out of no time. I know the notice was actually short. Thank you for taking the time out of no time to actually compile all of that and to put them together, and then you performed excellently. Thank you so much. If you don't mind, we would like to request for a copy of the presentation so that when sharing the recording of this, we can actually share that as well and just put it as a flip book on the website, and everyone can go into the library on the website and open and go through at their own respective convenient times. So thank you so much for that. And I want to say thank you to the facilitator, to the organizers, and say to all leaders of TORG and all the members and everyone that connected once again. The next webinar is going to be in another 2 weeks. And the topic of that is perioperative patient safety and communication in low and middle income countries. So that is going to, the speaker for that is going to be the chairperson of the TORG Rwanda chapter. So it's Dr. Patient Safety. I know it's very relevant in the operating environment, and it will definitely benefit everyone. So thank you so much, everyone. And depending on your time zone, I must say good morning, good afternoon, good evening, and good night. And we'll see you in another 2 weeks. Thank you, everyone. Have a nice day. Bye.
Thank you.